Hi friends. Now we have been doing a series called as Unplugged on YouTube channel, Damseli page on Facebook as well as on our YouTube channel, where we discuss clinical situations every time and we try to integrate medical learning for you. But in today's videos, I have not selected a clinical case. I have selected a new MRI sequence which I feel is of importance to you for your future exams, especially the central exams like NIMHANS, JIPMER, where they go towards technology which is useful in neuroimaging. So today I'm going to talk about a newish MRI technique, although it has been around for last 2 decades now, but it has taken value recently with the advent of new high strength MRI machine called as 3 Tesla MRI. Now it has taken more and more value in clinical usage. So I feel it can be asked as a future question to you. The technique that I'm going to talk about to you is arterial spin labeling. So far, we have been all dependent on use of gadolinium when we do MRI to understand the functional aspect of the disease, or use something called as bold technique, where we use the blood oxygen levels to look at the functional activation area. Well, arterial spin labeling is different, using magnetically labeled water molecules. So that is why we are calling it arterial spin labeled perfusion. An important thing to understand for everybody is that there is no radiation exposure here, there are no contrast material required, and we are able to do changes with more than what we are able to see on a pole technique. How we are doing arterial spin labeling is that you label the arterial blood water just below the slice of interest by applying a inversion RF pulse of 180 degree. Then inversion of the net magnetization of the blood water will happen. After a period of time which we call as transit time, paramagnetic tracer will flow into the slice or the region of interest. That tracer will now the tissue water, that will result in total decrease in tissue magnetization, and this image will now be called as tag image. Now we will do the same thing without the inversion pulse, and that will be called as control image. So if we subtract the control image from the tag image, we will be able to get in that slice, in that region of interest, we will be able to understand the amount of blood flow delivered in that section, which we can always call as cerebral blood flow. So this is the basic underlying principle. And there are techniques which are used to do this kind of arterial spin labeling, which is one is called as pulse labeling, or we say, and there's something called as pseudo continuous labeling. And the main advantage, although it may be theoretical to consider here, of PC ASL over pulsed ASL is it higher SNR, that is being signal to noise ratio, which it can deliver. And the major challenge of ASL has always been SNR. That is why, although it has been around for last 2 decades, only with the advent of 3 Tesla MRI, where we are able to get more signal to noise ratio, it has started to make more and more news. And I feel now is the time that they will ask you this in a multiple choice question as well in your future exams. So it has its own technical concerns because it's based on subtraction. So if there are movement artifacts, it will some problem, because we are subtracting a control image from a tag image, and it is also sensitive to the susceptibility artifacts. And it has mainly benefited from the advent of new 3 Tesla MRI and improved pulse sequences and receiver coils that we have today. So that has all improved our abilities today. Now let me show you how it works. Now you have a normal MRI image and an MRI image of a patient with Alzheimer's dementia, and this is A images are the PET scan images, and these are the ASL images. And because you know how integratedly linked our metabolism and perfusion are, so although the PET scan is looking at the metabolism, ASL is looking at the perfusion, and you can see high degree of correlation between them. So what we can achieve by PET scan, when we are trying to look at fluorodeoxyglucose, we are trying to look at metabolism, with ASL arterial spin labeling non-invasively without any dye, using MRI, using magnetic labeling of the inflowing protons of the inflowing blood, we are able to see similar information in both. So that leads us to the clinical usage. So today ASL has uses in stroke, to look for penumbra, to look for revascularization in chronic stroke, to assess the blood flow in dementia, just like we saw in our example before, to look for brain tumors, and to find out if there is a recurrence or not by looking at the blood flow. in to find the epilepticogenic focus, which would have increased cerebral blood flow in the ictal phase and decreased flow in the interictal phase. There's a definite role in understanding the in the localization of the psychiatric diseases, and even a territorial ASL is possible, where you can study the vascular territory of one vessel by labeling one vessel at a time and find out which area is being supplied by that vessel. So these are the possible clinical uses. I hope you benefit from our discussion in this educational exercise that we do on the DAMS YouTube channel. So please make it a point to follow us on YouTube at DAMS Daily channel, and follow us on the DAMS same name page on Facebook for more information. I would also encourage you to download our app eMedicos, which we have created, in which we share educational videos as well as educational cases, and there are e-learning courses available on that app now. I sincerely look forward to hearing your feedbacks in the comment section. Thank you.